Okay, at this time, we'll call this meeting to order at 8:30. And roll call, I believe everyone is present at this time. Approval of the agenda. Do I have approval of the agenda? Virginia, first, do I have a second?
Second.
Jeff, all in favor, say aye.
Aye.
Oppose? Any questions? Next, we'll go to the approval of the January minutes. Do I have a first? To make a motion. Milty, a first? Second, Kathy. All in favor, say aye. Oppose?
Aye.
Any questions? Then we'll move to citizen input. Is there anything? Nothing at this time? Any citizens here? Then we'll move to COVID update, and I'll give this to Cindy now.
Good morning, everybody. So I have some brief numbers for you that I'll share and then open it up to any questions you have as far as where we're at. Our total case count as of Friday afternoon was 2,489 positive cases. 42 of those are currently active. 2,413 have been cleared. On Friday, we only had one person left hospitalized and 34 deaths. We have seen our numbers go down a bit in the last 2 weeks. So we had been averaging an average active case count of somewhere between 75 and 110 for several months. And we are now down to more in the 40 range. So that's improving. We're seeing somewhere between 6 and 10 cases a day on average coming in versus the 20 to 30 and up to 40 at sometimes. So that's a good thing. We have seen an increase in the younger population getting it. So we're seeing a few more of our kids' numbers go up, which they had remained very low at the start of the pandemic. What our office right now is focusing on is vaccine. So I think the last time that I talked to you, I may have appeared quite frustrated. We weren't getting some of the doses that I had hoped to get. So let me give you an update on that. We have given 780 first dose vaccines, and we have completed 240 second dose. So what that means is 240 people have completed their series so far. And that was just last week where we started getting second dose vaccines. So today we're heading into week 5. And so for this week, we have received, hopefully it comes this afternoon, 150 doses for second dose, and we will be getting 175 first dose vaccines, which seems quite low yet. But I wanted to share with you where I was at a few weeks ago. So a couple weeks ago, they told us when we opened up to the 65 and up population, they told us to order vaccine and prepare for what we could handle. So I placed an order for 500 doses because we can easily do 500 doses within a day or two with the staff that we have. Of that, we only received 200, but we had planned ahead and had booked 500. So when you get that notice on the weekend, that means that Monday's a bad day. You have to call 300 plus people to cancel their vaccines. So what we did was we bumped them out a week. And then when we got our next week's allocation, we asked for 200 thinking, okay, that's what we had been receiving. We'll keep it at that. And they only gave us 100. So there again, we had to cancel and bump people out for a third week. So this week, we officially will get through the initial group of people that we had booked. So all of those people will now have received their vaccine. That is about 500 people off of our waiting list that will have gotten vaccine, roughly. And we still have about 1,500 people on that wait list. Now, that wait list is primarily people 65 and up. However, we do have some people who are essential workers that fall between, 20 and 65 that have requested it for when their phase opens up. It does not include any of our teachers in the area. That is a separate list that we have. It also includes, it includes some of our IRIS population, which is people who do in-home care or who are caring for family members who are at significant risk. So hopefully next week with our allocation, we can take a chunk out of that group, which qualify, as well as our transportation providers for the county. So I think that Melissa Anoy told me she had roughly somewhere maybe 10, 12 people on the transportation list that were interested, that are drivers who drive people oftentimes to and from those appointments for COVID testing and whatnot. So that's hopefully what we'll see at the beginning of next week get done, as well as then open it up further to our 65 plus population.
Cindy, if I can ask a question about that. So is tier 1 completed with everyone that wants it, or?
Not entirely, because they keep opening up new tiers or new groups within that. So that home care group would be new since we offered it initially in that first week. So those people, we still have to get in there. And we have, we've received a few calls, a handful from EMTs that decided they didn't want it, but now do, or firefighters, police, those people. So we have a small list going like that, but we really wanted to focus on the people that have been bumped 3 weeks running, just to get them done. And so with our next allocation next week, we will get those home care workers then. Yeah. March 1st has been the date that they gave us tentatively that they'll open it up to schools, which is going to be a big population to get done as well. It will not go to students at that time, but staff members. The challenge that we're facing right now is with the 65 plus population in Wisconsin, that's over 700,000 people. And a lot of them want that vaccine. So there's been an incredible shortage, and the allocations have been interesting, to say the least. So there was a lot of complaints and yelling that went on at the state level the last 2 weeks. And I'm sure I have a little star by my name because I wasn't real polite when they cut us drastically. And part of my complaint was, but we don't have a hospital. We don't have public transportation. We don't have the means for which our seniors can get to someplace easily sometimes. And their allocations, first and foremost, will go to federally funded places. So the tribes get 100% vaccine for whatever they ask for. Our community-based clinics are getting 100% allocation. And those are regional clinics that are being set up in more metropolitan areas. For instance, we have one at the Sunnyview Expo Center for Northeast Wisconsin in Oshkosh. So to expect our 70, 80, and 90-year-olds to drive on Highway 41 for an hour and a half to get a vaccine, not once, but twice, because that's where their second dose will go, I think is unreasonable and frustrating. So I voiced that quite loudly to a lot of people at the state level. And fortunately, we're still getting vaccine. We're doing a little bit better than our neighbors. A week ago, Door County only got 50. Green Lake County got 30 doses, and we had 100, but I guess that's a lot more than what they got. So all I can say is that we're just going to continue to peck away at those waiting lists and to do those priority groups as we can. When we see it,
I'm going to ask one question quick with that waiting list. So are some of these 65-year-olds, because I know of a couple of people that went to the clinics and did it from the county. So are they on the waiting list? And then when you call them, they're like, no, we already went to the clinic and got it because they could get into the clinic.
Correct. Some of them are on multiple waiting lists. We have in writing, on social media, and in person, highly discourage that, because what they're doing is they're blocking people from getting on those lists. So some people have been on 4 to 6 lists. And all I can say is that when we call them, if they've already got an appointment or they have already received it, they're taken off immediately. We go continually down that list. So we start at the top every day and we just go down. And that's what we're doing.
I know that the clinics have been asking also if you want a COVID shot.
But some of our clinics don't have the vaccine. Not everyone is a vaccinator.
Okay.
So in our area, none of our county clinics are offering that vaccine, to my knowledge, with the exception of possibly Door County Medical.
Okay.
Prevea was using their sites in Green Bay, so they're all to go to UWGB. Bellin was using their Ashwaubenon site so that their clinics don't get bogged down. So they can get it through their medical provider,
Okay.
but they still have to drive a significant distance. You know, Bellin's closest spot for them to go is the west side of Green Bay, and UWGB may or may not be the easiest place to figure out when, you know,
And it
when
was
you're a senior.
Bellin. It
Yeah.
was where they called for an appointment and the
Yep.
person was over 65, and then Bellin asked if they wanted
Right.
to get the COVID
And
vaccine.
they all have their wait lists. So some people have said, yeah, Bellin called me and let me know, or Aurora has their clinics too, but all of them, to my knowledge, are in Brown County. So the only vaccination site right now is our Expo Center here or our office. And then the other vaccinator that applied for this county was Hometown Pharmacy. So they had been working on their application, and I don't believe they've received vaccine yet. 2 weeks ago, when the shortages came out and the frustration hit, they stopped giving allocation to anyone who had not previously received it. So I think that the pharmacies, the big chain pharmacies are getting it. Some of the small mom and pop places are not. And it's just going to be a matter of increasing that vaccine allocation nationwide before some of those smaller entities get it. So as far as I know, because I can look at the actual vaccinator list, and there's about, I think, 1,300 vaccinator entities in the state.
Mm-hmm.
It was us and it was Hometown Pharmacy for this county.
Okay.
So that's where vaccines at. So we will be doing another large clinic tomorrow with those people that were put off for 3 weeks. So they're getting through tomorrow afternoon, and we were able to get the vaccine for that. I'm hoping to hold the majority of our clinics at the Expo Center. We have a pretty good setup there. We can social distance there. Julie has volunteered for us, and we appreciate that. So what we do is we bring people in. They have a socially distanced area to fill out their paperwork. They come back and get the shots. Then we have EMS off to the side, and they watch people for 15 to 30 minutes based on their health history to make sure that they're not having any side effects or allergic reactions. So it's really been working quite well. And I'm kind of toying with the idea of actually keeping it there for the schools as well, and having school staff just come to us instead of moving everything that we have and setting it up in each individual school and then having to do that again 3 weeks later. It's just very nice to have the setup that we have with all of our equipment and everything that we need in one spot. Any other questions in regard to vaccine?
Cindy, I just wanted to say I thought it was very well organized.
Thank
I
you.
mean, it was in and out in a matter of 20 minutes.
Yeah, it hasn't been taking long. So how we're doing it is each of our nurses has 3 people scheduled every 15 minutes. So basically 1 person every 5 minutes, which allows us to give that vaccine, sanitize everything. They go off by EMS. There's long lines where they sit there, and then they are issued out. We have timers that actually they're handed. They watch for their 15 minutes. If they're feeling fine, they're allowed to go. So it has actually been working quite well.
I've heard good things as well. Another question I have is in the positive test, the testing that we've been doing, we've had a lower amount of positive results. Are the people that are getting tested people that are going in for procedures? Are they actually sick people? Or what would you say that demographic looks like?
Interestingly enough, Kewaunee County remains one of the highest positivity rates in the state. We have been for at least 5 months, maybe 6. And it's because the people here don't get tested as frequently. I think that's what it is. So they go in when they are sick. And that's why we see the people that get tested come back with positive rates. And so we remain very high. I think it was last Monday, we were the only county left in the Northeast region that had twice a day testing at our CBRFs or our nursing homes because of our high positivity rate. And until as a county we drop down, they have to continue to do that twice a day. And it's at their expense. So we really want to see those positivity rates drop. Yeah.
Last week, my granddaughter, who's a senior in high school, was not feeling good. She was congested and so she went into Bella.
Kathy. Thank you, Jeff.
There you go. There you
And then
go.
it's all green.
Oh, there you are.
anyway, my granddaughter is in Kewaunee High School, a senior, and she was not feeling well and congested and everything. She went to Bellin, and they immediately did a test, and she had to go home and isolate herself. And then she got a negative test like 2 days later from, I guess, from Green
Yeah.
Bay. So, I mean, they are testing.
Yeah, our testing is still being definitely advocated for. We're still pushing as many people through. If they question those symptoms, things like that, people are going in and getting tested prior to procedures. So yes, that is a significant chunk of people. But overall, the people that get tested here test positive because they wait. I mean, they're sick when they're going in. Yeah, exactly.
Cindy, with the number of younger kids, those numbers going up, are you seeing more outbreaks in the schools or?
No, not necessarily. We've had some larger families that have gotten sick. So we've had households where multiple kids have gotten sick. We have had some quarantining going on in the schools. We had a couple classrooms that got quarantined in Kewaunee. Some of that is due to sports, not going to lie. But when we have one person test positive on a team, the team gets quarantined. So, we have seen some numbers in that regard, but not terrible. For the most part, Kewaunee County has really done an exceptional job at staying in school. Our kids are following with masking. They're following with the use of the barriers in school. They're doing a lot of good hand washing. The teachers have done an amazing job at encouraging all of that. And so I think we can really be proud of the fact that the kids have done good so far.
Any other questions? Virginia. Oh, Virginia, try again. No, I don't see it green, so I don't think it's working, Virginia.
Okay.
green.
What
Thank
is
you.
your opinion of people that were tested positive to go in and have plasma donations?
It's highly recommended for them after the fact.
And
Yes.
is there a place in Kewaunee County to do that? You have
No,
to go.
you have to go to one of the blood centers in Green Bay or the Valley to do it right now.
Okay.
Any other questions?
Cindy, the newspaper articles make it look like it's so bad. They're doing it per 100,000 population, and the numbers are like 22%.
I don't think that that's what our numbers show here. Granted, our numbers that we keep daily in our office might look a little bit different from what the state sees. And I'm not really sure why that is. I think ours are just more accurate because we're getting them day to day. They're always a couple of days behind. But I think we're doing better right now as a county, definitely with our numbers.
I agree with Julie. I think you pick up the paper and it makes it sound really, really bad. And I feel like we're doing a lot better.
And remember that as far as our ratings go in the state, that high positivity rate puts us as one of those counties, just because. So once we get that positivity rate back down, that's going to help. And the vaccine's going to help with that because we're going to have less positivity once more people are vaccinated.
And how, can I just ask your percentage, like EMTs and all that? Did you have a good percentage of people sign up, or was it a 50-50?
So EMTs is a little hard to judge. We were low on EMT and fire, in my opinion, but EMTs opened up a week earlier at Bellin for a regional center. So many of them had gone through that facility. We're probably at about 50% with those people. Fire, maybe a little bit less. Some of our fire was pretty hesitant to do that.
Is it with other departments too? Like whatever you.
Mm-hmm. It's across the state like that. Yeah, they were seeing more like a 30% vaccination rate instead of a 50. Okay. Yeah.
Anybody else? Any questions? Okay, then we'll move on to the next agenda. Discuss mask mandate.
So I just wanted to bring that up because we were getting a lot of calls last week when the governor's mandate was in question. It has been extended due to his public health emergency till March 20th. But I just wanted to put it out there to see where you guys feel we should be at as a county. Oftentimes I'm asked if we're going to have a county mandate. So is that an option? Is it an option for us to have a county advisory instead of a mandate, which recommends that people continue the same practice until, we have better coverage with vaccine? I just wanted to get a take as to where this committee is at. And if you wanted to take action, you certainly could as far as moving forward when March 20th hits. Where are we going to be at as a county?
Any questions on this? So I'm going to just say one thing. Cindy, I get out in the community quite a bit. So I feel that I believe we don't need to do a mask mandate. My opinion is because I think everyone is smart enough. If you feel comfortable that you want to wear a mask, you wear a mask. If you don't, and why I'm saying that is we have a mask mandate, but you go to a lot of places and there are a lot of places where people are walking in with none. And if somebody wants it, they have it on. It's their choice. I have a father who's disabled. He makes it his choice. That does not keep him away from church. There are people that do not wear it. It does not keep him away from other things where people don't wear it. He puts it on if he thinks he needs it. For my mother, the same way. But I think at this point, I feel comfortable to say that it would be a person's choice. Cindy, I think too, you've been out and about where you go to places and people are not coming in with a mask and you don't have a right to make somebody wear a mask if you don't know their health reasons or whatever. So
I think my question would be, how do you feel about the health department putting out either a strong recommendation or an advisory? So, ultimately, they look to us for those recommendations. And so I'm not sure that it's in our best interest to be like, whatever.
I wouldn't
what I
ignore
mean?
it, but I think
So how do you feel about that advisory or that recommendation?
a recommendation I think would be good. I think if you do a mandate, if it doesn't get passed and we as a county, there's people not doing it with the governor right now. So that's my opinion. And one thing that just bothers me, and I'm going to bring my kids up again. So my kids have to run around with a mask playing sports and you have the pros, you have football last night on national TV. They're hugging each other and everything. And my kids have to play with a mask on as they're running up and down the court trying to get air. And I'll tell you, you go to some of these big hospitals, they just are appalled because they're like, in 2 years, we are going to have so many issues with kids in their lungs because of what we're doing. So that is probably one big thing that I'm an advocate is you want to wear a mask. We advise you to, if you want to put some advisory in, I'm great, but I don't want to wreck the condition of my kids and their future, especially when you go to some of these doctors that are telling us, what are we doing to our kids? And I'm not talking about the doctors around here. I'm talking about some of these doctors that are big honcho doctors in big facilities where they're just appalled by, and then you have college and pros who don't have to wear them. And last night I'm watching the Super Bowl and I'm looking at these guys hugging each other and I'm thinking my kid's got to run up and down a court trying to get air, so that's just my opinion on things. And I'm looking at the future of my kids and that's my biggest future right now. If you want to wear a mask, wear it, to protect yourself. I agree, but don't take that away from some of these people that don't have a choice. Go ahead, Virginia.
Okay, I'd like to make the comment that we should highly recommend to businesses that the business employees are wearing. I've been into a couple places where they have a sign, you must have a mask to get in, and then the person waiting on me isn't wearing a mask, and one person was coughing like crazy at me without a mask on, and I was wearing one. So I think if we would at least tell the businesses to have their staff use them, I think
I
that
don't
would
think
help.
you can make a business staff wear them though, correct?
Well, right now they can because it's a state mandate. So it's a law throughout the
But you
state.
can't, if somebody is working, you cannot, because if they have them.
Well, correct. If they have a certain health condition, they can't be forced.
Yep.
So there could be issues beyond that. But right now that state mandate is in place. So it really is the law currently.
Go ahead, Milty, then Linda's next.
Yes, let's leave it the way it is. Don't change anything. What I feel like you said, Kim, what you said explains it well. So yes, leave it the way it is. With the state a mandate and just an advisory, and that's enough. Everyone's told me, a lot of people out and about are saying, yes, I don't want anything to change. I don't want to have a law or a mandate for the county. Correct. Thank you.
Linda, you were next.
On the news this morning, I'm not for sure where it was, but they talked about fining people that didn't have a mask on. Now, we are governed by the governor and that mandate, but what does the president say? Is there,
He has no control.
does he have a specific date? the
Not
president?
unless it comes down federally, which it
Right.
hasn't right now. So it's being done by individual states.
Mhm.
And we have the ability to fine people right now if you do it through a civil forfeiture. So that's what's in place right now, which means that if people were violators and you so chose, you can turn their name into the DA's office and the DA has the right to take action if he so chooses. We have not done that because, first of all, with our limited amount of people that are in that capacity, it would overwhelm our office. It would overwhelm the sheriff's department. It's going to overwhelm everyone to do that. So we've chosen to do certain recommendations to businesses. So for instance, if we get a third or fourth call on a business saying that they have blatantly ignored it, people are upset, whatever, I reach out by phone calls to talk with them, but we haven't done any kind of turning into the DA's office at this point.
So there's no federal mandate or recommendation?
No.
Jeff, then Pastor.
So, yeah, I think there's a lot of contradiction going on in our country over the mask. And I don't doubt that people that are at risk should either be avoiding public exposure as well as wearing a mask. But I don't believe that we should have a mandate in the county. Having a recommendation for those at risk and some language like that, I think coming from Cindy's office would be good. I'd like to see what that looks like before it would be released. But I would make a motion that the Kewaunee County will not have a mask mandate, but we will have an advisory put out.
You wouldn't have to have a motion. I mean, if this committee is taking no action, if you're simply going to say we're not going to put a mandate into place, you would not have to have a motion for that because you're taking no action. If you want to say we're going to put out an advisory and we want to encourage people, I mean, you could make a motion to that effect. Wouldn't have to. And
That's possibly something that we could do maybe next month when it comes closer and we see whether this is going to go, further or not. A lot of what the governor's office is doing or the public health emergency that he has in place also is dependent on some of the state funding. So I think, you're going to probably see something come down from the state, hopefully, because that federal funding won't continue if they don't. So hopefully it'll be taken care of that way. And certainly I would reach out to all of you first before putting anything out like a recommendation or advisory, put that in writing, get your approval. So we will certainly do that in the future if it becomes a need.
So then I'll revise my motion to be that our response would simply be an advisory from the health department.
Okay. So I have a first. Do I have a second on that motion?
I second it.
Who said? Julie. All in favor, say aye.
Hold on. Before you go to that, I would make a couple of points. Federal, the federal government does not have, that would be a constitutional issue. They don't have the authority to make a federal mandate. That is up to states, pure and simple. The president can do it on federal property, which he has done, which was already in place anyway. So I don't know what that accomplished. As far as businesses go, it's fine. You can do whatever you want. But my advice would be if people are complaining about businesses and they don't like that certain businesses aren't enforcing things to their liking and they feel that they aren't comfortable wherever there's a mask, well, then don't patronize those businesses. It's called free market. Go to the businesses. Don't go to businesses, and businesses will respond to what their clientele will allow. So I mean that's just one thought on that. The other part of it is with the vaccine going out, the cases are going down. I was listening on the radio on the way here. Israel now has 30% of the population vaccinated. Hospital visits for COVID have gone down by 30%. They were talking about even with the when people have the first vaccine, it reduces it by how much. And I just want to make the comment on the whole mask issue. If people want to wear a mask, that's fine. But I know when the state mandate went into place, we had, I believe it was around 7 active cases in the county. 2 weeks later, it had gone up exponentially. In every single instance where mask mandates have been put into place, the number of active cases has gone up without exception. And so I know we keep hearing follow the science, but my comment would be, why don't we follow the math and look at that as well? But again, if people want to wear them, go ahead. But mandating people to wear masks, that's a whole nother level.
Go ahead, Milty.
I echo exactly what Reverend's saying. I don't want an advisory. Nothing. Leave it the way it is. And if you want to wear it, wear it. Wear America. Make your own choice. No advisory.
When you go out into public, you assume a certain level of risk no matter what.
So I had a second on the advisory, but I'm just going to clarify this, how we're doing this. So Jeff, if you want to repeat what you did, because we have a second. So
the motion was for the health department to put out just an advisory stating simply that if you're at risk group, you can, it's recommended to wear a mask. I'm not making a recommendation that businesses and their personnel should be wearing masks, nothing like that. It's an individual choice. And that advisory is just going to come out from the health department stating that if you're at risk, it's recommended that you wear a mask. Well, that's simple. Nothing more, nothing less.
And that would only be if we would lose the state mandate, correct?
Right.
Yeah.
mm-hmm.
If state mandate's out, we have no reason to do anything.
There'll be no mask mandate.
Correct.
Just to guide people that they still feel, if they want to feel safe, it's their choice.
It's just like the CDC has information on their website. You take it or leave it.
Mm-hmm.
The information is there and that's your choice. You take it or leave it. That's what we're doing.
And will that be probably, Cindy, on the website then is where you will have that choice that people can guide and have any questions, but nothing mandated.
Correct.
Okay. And Julie, sorry, is that what you were okay on then on your second?
Yes, that's fine.
Okay. Then all in favor say aye.
Aye.
Oppose?
Nay.
Then we're good. And then we'll go ahead. We'll have no mandate, but just that people have questions, they can go to that website and they can ask, and giving people a choice. Okay, I'm going to move on.
I have a question.
Oh, I'm sorry, Linda.
If somebody's had the virus and now they're over it, do they still need to wear the mask or do they not? Because somebody told me, well, I already had the virus. I don't have to wear the mask anymore.
So immunity from having the virus is known to last at least 90 days. So you have 90 days. It's a 90-day period where you're considered immune. But as far as the state masking mandate goes, it does not make exception to whether you've been positive or not. So you need to continue to wear that mask.
Yes, Kathy.
My son is in education in Illinois, and he has not been in school at all. September, he stayed home, and he did get the vaccine. And he said he was told that with the first dose, you're like 50% covered. The second dose, you're higher, but you still could get the virus, but it will not be as strong, as dangerous.
I don't think we're ever going to get rid of it. It's like, I'm sorry, but it's like the flu, and the old fashioned way was, it's okay to get the flu because what do? You build your immune system, I'm okay if my kids get sick or it builds their immune system. When we were young, we all went and got the chicken pox at the same time. Mom loaded us up and took us to the house. And, I think some of this too also comes down to how we take care of ourselves. Is a big thing too. So how we take care of our bodies. So if you beat up your bodies, your immune system is struggling. So, or if you have health conditions, whatever. So, but any other questions, Pastor?
I mean, it's just a suggestion. I mean, and I don't hear much about it. I guess maybe I don't listen to the right things, but I would like to hear a lot more discussion coming out on every level regarding obesity and cigarette smoking. I believe those are the two main underlying conditions, and they're both quite treatable. So, I mean, put down the ho-hos, put down the camels, and get off the couch, and we might be a little bit better prepared for all this.
Yep. Milty?
Thank you. That's a very good explanation about the health issues of people. Thank you, Reverend.
Yep, I agree. That's probably our biggest topic, is why we have the situations we have in this country is because of how we take care of our bodies. So, all right, anything else?
One other comment.
Yes.
Because I see there's no other place on the agenda, I just wanted to say, I know that this has been an incredibly stressful situation for a lot of people, especially the public health department. And I wanted to express my great appreciation to Cindy when I had a situation, we had a question in the school, didn't know the answer. Everybody has answers. And apparently, if you work for any medical facility, in any capacity, even as the custodian, you are a self-proclaimed expert on the coronavirus and how to handle quarantines and so forth. And I had to send an email to Cindy. I believe it was after 10 at night. And she didn't get back to me that night, but she did respond to me at 6:20 in the morning, which, it told me two things. First of all, I always think, am I the only person that's working at these ridiculous hours? But it was of tremendous benefit. I know it probably may not seem like a big deal, but when you have lots of conflicting information and opinions, and even some of that comes from primary care doctors at times, it is extremely difficult in an institution to know how do we calm people and get information out and getting a clear answer to them, and having that kind of a timely response was just so incredibly helpful. So I wanted to express my appreciation for how incredibly vigilant the public health department has been. I would suspect that I probably am not the only person that sends these cries for help at odd hours, and so the fact that you make such efforts to respond to these things is really, I think the county is very, very well served from that. And I think that helps immensely in being able to calm people and being able to get through some of these situations. So I want to express my appreciation for that.
Thank you.
Anything else? I do have one thing. So we all have to, with the mask, what's up with the double mask that you're hearing so much of, and it's just being pushed by physicians, like certain physicians.
Triple. We just need to get people to stop breathing in public.
Yeah, and that's where I'm at. You got one physician here and you got one here, and my dad was like, how you put 2 masks on? I can just barely breathe with one.
Yeah.
And he said, you're going to have somebody do that. That's like a health scare.
Yeah. It's for some people much more difficult to breathe. And I think it's just people hyping up.
Panic.
Yeah. One more layer of protection is what they think. So
Yeah. Okay.
Yeah.
All right. Okay. We'll move on. To the grant update.
I just wanted to give you an update. And I apologize. Public health funding is never simple to understand. That's for sure. And with COVID, it's been changing on a monthly basis. So last year, if you recall, we received specific funding for contact tracing, for testing, and for planning. That funding has gone away as of December 31st, and we now have CARES funding for epidemiology. So it's ELC, I think is how it's termed on some of your funding sheets. And we had originally been given it for 2 years. Then they took that away and gave it to us for 6 months. Now I think we have another answer. So the most recent information I have is that we will receive ELC CARES funding, which can cover efforts for vaccination. It can cover efforts for testing. It can cover efforts for contact tracing. So it's kind of an umbrella for all of them and for our planning efforts to the tune of about $145,000 that this county will receive through June. And that is for what we bill for. So it's not going to be a lump sum that we get. It's going to be reimbursement for what we charge to the state, to those specific categories. And then beyond that, they have informed us that there will be somewhere between $250,000 and $300,000 that will continue within that funding area through December of 2022. So I think, as we see this virus evolve and the amount of work that goes into it evolve, that may change again. But that's their estimates right now for what local funding we will receive through the CARES Act.
So just to backtrack, so some of that funding they gave us that they said they were going to give us in the beginning, you didn't get.
We got all of it.
You did.
And some of it we couldn't use. There was just simply too much.
Okay.
But we used as much as we could into different efforts that fell within those categories.
Yeah.
And it's probably not on this final one yet because that CARES Act funding, just submitted at the end of January.
Okay.
So hopefully in that end of year report that you get that comes out around March, you'll see the exact numbers that went into testing, planning, and contact tracing.
Because was that like near $200,000, if memory serves me?
Mhm.
So how much of that did we actually end up getting reimbursed? All of that?
Just about.
Excellent.
There was there was some that went back from testing. I believe that was the category that we didn't use, and we had 55,000 there. So there was maybe, I can't tell you how much we didn't use there. We had 30,000 in planning. Just about all of that was spent. And then for our contact tracing, it was almost 100% spent.
I can't imagine this 145,000 will be hard to spend either with all the vaccination going on, all the
Correct.
contact tracing continuing.
Correct. So we still have 3 contact tracers that we're contracting through the county.
Mhm.
Okay. In addition to our staff that is contact tracing, and then all of our vaccination efforts. And then the things that we need over and above for the vaccination clinics, like privacy screens. We purchased more of those. We purchased more syringes. The kind of supplies that's all coming out of this. So I would say I would think the 145,000 we will go through, and then we will have that additional, I think it was 305, but don't quote me on that number because it's changed so many times through the end of 2022.
Okay. Any other questions on the grant? Then we're going to go to the reports from Cindy, which would be the January monthly report.
So in front of you, the January numbers are there. Contracted caseload for WIC remains at 218, and we have fallen just a little bit to 201 this last month. I think that will come back up. January is kind of a tough month to get people to come out in. Communicable diseases, we had 1,846 reported, 414 were confirmed. Of those confirmed, I would say all but maybe 10 were COVID. We had a spike in STDs recently, so people are returning to their normal activities, I guess. For probable cases are all COVID in there, and that would be people who have all of the symptoms of COVID, but have gone in and received a negative test, but are living with someone in their household who's positive, and they are showing every symptom the same. So that's what that is. Immunizations, 669 were done in the month of January. That's reflecting some of those vaccines that we're doing right now for the COVID vaccine. Other than that, it's a pretty lengthy list of meetings, conferences, activities. Does anyone have any questions on any of those?
I just had one question on the nutrition one. How is that going? Is that still, you're getting good responses? And I think I'm just asking just because of what we talked about earlier about your health.
Yep.
Is a big thing.
During last year, the nutrition and physical activity work group did kind of pause their activities. They're back out and doing several meetings. They now have a bingo challenge that's going on for the month of January, where people can take part in different kinds of physical activity with a chance to win. I believe it was a Packer jersey this month. So we're doing that in conjunction with Bellin Health, who supports a lot of those activities with us. But no, they are out and about and doing more of that. As far as just even in the building, our wellness program is back to doing more. Jessica sends out a Tuesday stretch. It's a 10-minute stretch. So she sends out a video every Tuesday for employees that they can use to just do a 10-minute stretch at their desk or wherever it might be to get them moving. We continue to do challenges within the building. So challenging people to do better either diet or exercise type of activities. And, I would like to get more of those. Last year, we did some of that during the winter to the community on Facebook. I think if you remember that.
What about with the health center? Remember it wasn't it for 65 and older? You had the health fit or fit.
Correct.
Yeah.
So unfortunately, that falls under the University of Wisconsin, and they've halted those kind of services. We still have the grant. We have all of it, and we're just waiting for them to give us the red light or the green light to go. We had started it back up in September, and then our cases spiked, and then they shut it down again. So hopefully we can get that's called the PALS program.
Okay.
And we're hoping to get that up and running soon.
Great. Any other questions? Then we'll move to department updates, and we'll do agency. And then if you want to roll right into financial.
Sure. I don't really have a whole lot of agency updates for you. This last month has just been overwhelmed with vaccine planning and distribution. So that's what the majority of our office has been doing. It's a full-blown effort with all of us taking part in all of those clinics typically. So we have Deanne and Rachel that do a lot of the registration type of things. We have Jessica, who we have trained to do the draw up for us. We have Sydney, who is one of our contracted tracers, who is also a Bellin College of Nursing student, who comes with us to do a lot of the draw up for vaccines. The draw up of this vaccine is far more complicated than any other vaccine we have. So it's a process. It's not a quick thing to administer. And then we have Allie, myself, and Mary Novak. I think most of you probably remember her. She was the vaccination nurse for 35 years, at least in this department, and she has come back out of retirement to help us out. So in addition, we have had a number of people volunteer their services. So we have quite a list of vaccinators that we can call on if we want to open something bigger, if we ever get the doses that we need to do so. NPAW has been meeting monthly, so that is the Nutrition and Physical Activity Group. We have not been in the schools recently to do exercise and those kind of things. That's kind of been taking a little bit of a pause right now, simply because of a lot of the schools having limited visitation at this point. But otherwise, our immunizations, TB skin testing, those kind of things continue as always. And WIC clinics do as well. rolling into that financial report, this is the December report that's in front of you. So the big thing that you will note is that the majority of the grant funding is down to 99% to 100% spent. In the first category, which is public health, nursing, those are the state or the tax levy dollars. And as you can see, remaining in there was 32,769, and that is probably close to, when final counts come out, what we will be giving back to the general fund. And then communicable disease, you can see, was spent down to 99%. The next category, the 54106, which says the immunization program, that is also tax levy dollars. There's a portion of the immunization that is funded by the county, and we will be giving just about 5,000 back to the general fund from that category. With WIC, it is our one grant that we had trouble spending down completely this year. So there is some WIC funding that will go back to the state. We spent about 93% of it. And that was more because their services were halted for quite a long time with not being able to see people in the office. Children and youth with special health care needs was spent down, 32 cents left. When you look at lead, that was spent down as well, 99% of it. Maternal and child health, all these grants were spent down almost entirely. Just a few cents left. When we go a little bit further, bioterrorism is not. So you're going to see that one has 70% left in it. And that's because that grant goes June to June. So we're in the process of spending that down now. It runs on a different time frame than the other grants. The next category under that, you'll see COVID FEP. It says FEP COVID-19. That one will not be spent down entirely either, but that's because that one runs through March. But we're close. That one will be spent in its entirety by the end of March coming up. And then when you scroll down further, so there's an ELC Cares category. It's the 54129. And that one we didn't spend much in 2020 because that money would carry over through August. So that was the one part of the CARES funding that we carried over, and that's now the grant that we have to spend for this year. Underneath that, you'll see COVID-19 testing. And that one, I don't think we have final numbers in that one. That's the one that we would have finished submitting. That one is the one we had 55,000 available in and was just submitted fully at the end of January. Planning is right below it, and that one we spent 29,000 out of the 30 that we got. So that one was spent almost in entirety. And then contact tracing shows that we spent 122 remaining, but that's not correct because that one was then submitted at the end of January, as well. Yeah.
So contact tracing, and some of these things, have you kept track of, like yourself, I know being salaried and everything, but have you kept track of the time that you've put in since this has began at all? I mean, do you have an idea? Because does that get charged to the CARES then?
No.
Or can you only charge your actual
So
salary
my staff can get their salary taken out of the CARES dollars, but the health officer cannot. So yes, I have kept track of all the hours that I put in.
6 o'clock in the morning, for
over
example?
and above. Yeah, correct. Above the salary. So yeah, I do have that written and down in my office. But that is not reimbursable.
Could you provide that either to me or the chairman of finance?
Yes, I can.
Thank you.
Yep.
Thank you.
Were you done?
I'm
Cindy?
done.
Okay.
Yeah, so unless you have questions on the financial report, so like I said, that final one will come out in March, when all of the cars is finally reported entirely. But as far as grants go, 100% spent down for what we needed to.
Okay. Any questions? We'll move then to the travel request approval.
Yeah, we have none.
Nothing. Then we'll go to the overtime report.
And the overtime that our office is seeing right now has gone down a bit for the last month. So I have 1 to 2 contact tracers that do some Saturday call, but my overall staff right now with the lower numbers is not working weekends again. So we have Sydney, who's a college kid and has volunteered her time. So she is about the only one. And I would say she averages 2 to 3 hours on a Saturday. And that would be the only overtime that we're paying out right now. I should say though, the rest of the staff, when we do a vaccination clinic, we sometimes run over. So you'll see some overtime for Allie. And that is because for the last several weeks, we have been doing police, fire, and rescue at night. And Deanne comes on some of those clinics with us. So Deanne and Allie have some of those hours that are in there for those extra things outside of the regular office hours.
I just wanted to say, as one who has had both shots now, that's one of the easiest vaccines I've ever had.
That's good to hear because some people don't say that, but yeah.
Having gone through the shingles vaccine, this was nothing.
That's good. That's good to hear.
Didn't notice a thing. And I'm a baby.
All right. Any other questions? Then we'll move to the next meeting date. Okay, I'm looking at, I believe it would be March 8th in the morning at 8:30, if that's okay with everyone. Okay, Deanne, okay. So 8:30 on March 8th. And I'm going to check with the vets. Otherwise, we'll have vets right after health. Okay. If something changes, I will notify you. Oh, we never, yeah, sorry. We pushed them aside.
Kim's buying donuts next month?
Yes. I'll bring donuts in. Do you want to?
You can do it. How about the adjournment? We'll do that.
Okay. All right. So, any other matter? Okay. Any other matters before I do that? Okay. Then I have a motion to adjourn. Do I have a second? Kathy, all in favor, say aye.
Aye.
Oppose?
What's your screen now?
Oh,
Yep.
vote.
Oh, we're going to do it with the screen. Okay, yes.
Okay, everyone vote to adjourn then. Hit the screen. Did you do it, Linda? If you vote if you want to end the meeting or if you want to stay here, Linda. Everyone put their vote in? Do you see it?
Yep.
Okay, this meeting is adjourned. Thank you.
I got to vote twice, by the way.
Cool.
Go back and hit it again.
So it's really,
I don't think it recorded.
It didn't?
No, it didn't record it.
it went from one.
Oh, okay. Oh, shoot.
Somebody voted no, though.
I did.
Oh.